I'm about to show you something that could literally save your life or the life of someone you love. Every year, medication errors kill more people than car accidents. That's not an exaggeration. That's a fact from the FDA. And most of these deaths are completely preventable. What if I told you Teresa's simple system that can reduce your risk of medication errors by 95%? Would you want to know about it? Of course you would. Because taking the wrong medication, or taking the right medication the wrong way, can have devastating consequences. Stick with me for the next 10 minutes. I'm going to walk you through a medication management system that actually works. This isn't complicated. It doesn't require expensive apps or gadgets. It's a proven method that hospitals use to keep patients safe. And you can use it at home starting today. Let's start with why this matters so much. The average American over 65 takes 4 to 5 prescription medications daily. Some take 10 or more. When you're juggling multiple medications, the risk of error skyrockets. You might take the wrong dose. You might take medications at the wrong time. You might accidentally take the same medication twice. Or you might forget to take a medication altogether. These mistakes aren't just inconvenient. They can be deadly. Blood pressure medications taken at the wrong time can cause dangerous spikes or drops. Diabetes medications taken incorrectly can lead to life-threatening blood sugar levels. Blood thinners taken in the wrong amounts can cause internal bleeding or strokes. Here's what makes this even scarier. Most people don't realize they've made a medication error until something goes wrong. By then, it might be too late. That's why having a reliable system isn't optional. It's essential. Now let me introduce you to the 5-step medication management system. This is the same framework that healthcare professionals use. I've simplified it so anyone can implement it at home. Each step builds on the previous one, creating multiple layers of safety. Step 1 is creating your master medication list. This sounds basic, but most people skip this crucial step. Your master list should include every single medication you take. That means prescription drugs, over-the-counter medications, vitamins, supplements, and herbal remedies. Everything goes on this list. For each medication, write down the name, the dose, how often you take it, and what time of day you take it. Also note why you're taking it. This last part is critical. When you know why you're taking each medication, you're more likely to take it correctly. You're also better equipped to spot potential problems. Keep this master list in 3 places. First, in your wallet or purse. Second, on your refrigerator. Third, give a copy to a trusted family member or friend. Why 3 places? Because in an emergency, medical professionals need this information immediately. If you're unconscious or confused, that list could save your life. Update this list every single time something changes. New medication? Add it immediately. Stop taking something? Remove it right away. Changed a dose? Update it that same day. Your master list is only useful if it's accurate. Step 2 is organizing your medications physically. This is where most people's systems fall apart. They keep medications in random places around the house. Some pills are in the bathroom cabinet. Others are on the kitchen counter. A few bottles are in a bedroom drawer. This chaos leads to errors. Choose one location for all your medications. Make it somewhere you visit every day at the same time. For most people, that's the kitchen. The bathroom is actually a terrible choice because heat and humidity can damage medications. Find a cool, dry spot away from direct sunlight. Get a medication organizer box. Not the cheap plastic ones from the dollar store. Invest in a quality organizer with clearly labeled compartments. The best ones have separate sections for morning, noon, evening, and bedtime. They also have compartments for each day of the week. Fill your organizer once a week on the same day. Many people choose Sunday evening. This becomes your medication prep time. Set aside 15 minutes when you're alert and focused. Don't rush this process. Double check each medication as you place it in the correct compartment. Here's a pro tip that nurses use. When filling your organizer, work with one medication at a time. Take out the bottle, count the pills you need for the week, place them in the correct compartments, then put the bottle away before moving to the next medication. This prevents mix-ups. Step 3 is establishing a consistent routine. Your body thrives on routine, and so does medication management. Take your medications at the same time every day. Not approximately the same time. The exact same time. Set alarms on your phone for each medication time. Don't rely on memory alone. Even people with excellent memories forget occasionally. Alarms remove the guesswork. When the alarm goes off, take your medications immediately. Don't tell yourself you'll do it in 5 minutes. That's how doses get missed. Pair medication times with daily activities. This is called habit stacking, and it's incredibly effective. Take morning medications right after brushing your teeth. Take evening medications right before dinner. When medications become part of an existing routine, you're much less likely to forget them. What about medications that need to be taken with food or on an empty stomach? Plan your schedule around these requirements. If a medication needs food, take it with breakfast or dinner. If it needs an empty stomach, take it first thing in the morning before eating. Step 4 is tracking and monitoring. This is where you catch problems before they become serious. Keep a simple medication diary. Each time you take your medications, make a quick note. You can use a paper notebook, a phone app, or even a calendar. Your diary doesn't need to be elaborate. Just note the date, time, and which medications you took. If you experienced any side effects, write those down too. This creates a record you can share with your doctor. It also helps you spot patterns. For example, you might notice you always feel dizzy an hour after taking a certain medication. That's valuable information for your healthcare provider. Or you might realize you consistently forget your evening dose on Tuesdays because that's when you have dinner plans. Knowing this pattern lets you plan around it. Monitor how you feel overall. Are your symptoms improving? Are you experiencing new symptoms? Changes in how you feel can indicate that a medication is working, not working, or causing problems. Don't ignore these signals. Watch for interactions between medications. When you start a new medication, pay extra attention for the first few weeks. New side effects might indicate an interaction with your existing medications. Report any concerns to your doctor immediately. Step 5 is regular medication reviews with your healthcare provider. At least twice a year, schedule an appointment specifically to review all your medications. Bring your master list and your medication diary. This isn't about treating a new problem. It's about optimizing what you're already taking. During these reviews, ask important questions. Do I still need each of these medications? Are the doses still appropriate? Are there any new interactions I should know about? Could any medications be discontinued? Sometimes people take medications long after they're needed simply because nobody reviewed the list. Also discuss over-the-counter medications and supplements during these reviews. Many people don't realize that vitamins, supplements, and OTC drugs can interact with prescription medications. Your doctor needs the complete picture to keep you safe. Bring all your medication bottles to these appointments. Not just the list, but the actual bottles. Your doctor can check that you're taking the right medications and that the labels match what was prescribed. Sometimes pharmacy errors occur, and this double check catches them. Now let's talk about special situations that require extra attention. If you care for someone else who takes medications, like an elderly parent or a child with chronic illness, these same 5 steps apply. But you need additional safeguards. Never let the person you're caring for manage their own medications if they have memory problems, confusion, or difficulty reading labels. This isn't about taking away independence. It's about safety. One mistake with medications can undo months of good care. If you're managing medications for someone else, communicate clearly with all their healthcare providers. Make sure every doctor knows about every medication. Specialists sometimes prescribe medications without knowing what the primary care doctor prescribed. You're the safety net that catches these oversights. What about when you travel? Your medication management system travels with you. Pack medications in your carry-on bag, never in checked luggage. Bring more than you need in case of delays. Carry a copy of your master medication list and copies of your prescriptions. Keep medications in their original bottles when traveling. This is especially important for controlled substances. Having prescription medications in unmarked containers can cause problems at security checkpoints or border crossings. Set reminders on your phone that account for time zone changes. If you normally take medication at 8 a.m. Eastern Time and you travel to the West Coast, you need to adjust. Your body still needs the medication at the same interval, even though the clock shows a different time. Let's address some common mistakes people make with medication management. First, never share medications. What works for you might harm someone else, even if they have the same condition. Medications are prescribed based on individual factors like weight, age, other medications, and overall health. Don't stop taking medications without consulting your doctor, even if you feel better. Many conditions require ongoing treatment even when symptoms improve. Stopping suddenly can be dangerous, especially with medications like blood pressure drugs, antidepressants, or steroids. Don't adjust doses on your own. If you think a medication isn't working or is causing side effects, talk to your doctor. They can adjust the dose or switch medications. Self-adjusting doses often makes problems worse. Never take expired medications. They might be less effective or even harmful. Check expiration dates when you fill your weekly organizer. Dispose of expired medications properly. Many pharmacies have medication take-back programs. What about the cost of medications? If you're struggling to afford your medications, tell your doctor. There are often less expensive alternatives. Generic medications work just as well as brand names for most people. Patient assistance programs can help with costs. Never skip doses to make medications last longer. This is dangerous and often leads to worse health problems that cost even more to treat. Technology can enhance your medication management system, but it shouldn't replace the basic 5 steps. Medication reminder apps are useful, but only if you actually respond to the reminders. Smart pill bottles that track when you open them are great, but they can't tell if you actually took the medication. If you use technology, choose tools that integrate with your existing system. An app that syncs with your phone's calendar and sends reminders works well. A pill organizer with built-in alarms can be helpful. But fancy technology isn't necessary. The simple 5-step system I've outlined works perfectly well with just pen, paper, and a basic pill organizer. Here's the bottom line. Medication management doesn't have to be complicated, but it does need to be systematic. The 5-step system works because it creates multiple safety checks. Your master list ensures you know what you're taking. Physical organization prevents mix-ups. Consistent routines prevent missed doses. Tracking catches problems early. Regular reviews keep everything optimized. Implement this system today. Start with step 1 and create your master medication list right now. Then move through the other steps over the next week. Within 7 days, you'll have a complete medication management system in place. Your health is too important to leave to chance. Medication errors are preventable. This system prevents them. Use it, stick with it, and you'll dramatically reduce your risk of dangerous mistakes. Your future self will thank you.